I'm so happy we're here because one of the things that there's so much conversation and so much talk around so many different healing modalities over trauma therapy, over exercises we do and practices we have and healers and appointments we make. And like you brought up when we were just saying, people want to know, like, what am I going to get out of that? And in this case, I'm so excited to actually just have anybody who's curious watch this to learn, because sometimes it's so much easier than trying to explain something that is almost beyond explanation. It's an experience. So, thank you. And thank you for both experiencing this stuff with me. And Sheena, thank you for having Kelly and I both in your last cohort of teaching this incredibly powerful modality, which is almost, when I describe it to people, I'm like, no, it's colored glasses and it does stuff. But what do you call it? And what is it for people listening? What's the definition of this modality or therapy?
It's just colored glass therapy, right? It reminds me of a friend of mine that asked me, like, what do you call that black bird with the red wings? And it's a red-winged blackbird. It's just colored glass therapy. That's
Amazing. And how did you discover it?
I was introduced to it by Dr. Daniel Assis, and he is the same medical doctor that developed the auricular chromotherapy, that's shining colored light on your ear. And so he introduced me to the colored glass therapy.
Great. And then, my last question for now, for this little bit is, who's it for?
Who's it for? It really can span a huge number of approaches. Different practitioners can use it in very different ways. I have energy workers who are just working with the body, do colored glass therapy while they're doing energy work. I have psychiatrists using it to try and help define some of the issues that their patients are helping, that they're helping their patients with. Um, it can be used for physical symptoms. It can be used for emotional symptoms. Sometimes the target problem is helped, but also non-target problems are helped. For instance, one woman, we were addressing a very different issue with an interaction she was having with a colleague, and then all of a sudden her wrist function dramatically improved, where she had no recognition that that was tied together. So there's a lot of bridging the unconscious with the conscious component, and then really just letting go. There's no, this is what it does. It's whatever your system is really going to need. That's why it's so beautiful and I think so effective.
Right. I mean, it is beautiful. That's for sure. And it's definitely powerful. And it's good for kids, like all ages. And anybody, is there a contraindication or somebody who shouldn't either receive it or learn to practice it?
Not that I know of, but then, I can't make that decision for everybody. When we're in our monthly working group, you know how in kindergarten they have those playstations?
Yeah.
I love to have a little PlayStation of the colored glasses, and the kids go and try the different glasses on, see which one they like best, and wear them for, 10 minutes, 15 minutes, like
Right.
just to explore, because a lot of it is, what does your system need and want in this moment? And teaching kids that there can be some really easy impacts and remedies using color.
Imagine if we all learned that in kindergarten, right?
Imagine.
Tool for a toolbox.
Yeah.
Yeah.
And I love your answer. And I want to leave it at that. It's like, I love that you said you can't answer it for every person, right? It's like, there's no definitive answers. And I think that's one of the things that's so beautiful and maybe missing, which is like, you can come in for this therapy, have this experience, and you leave with this. And this isn't, you have to like
Right.
show up and want to have this experience, whatever it's going to be. So with that,
Right.
here, Kelly's like ready to be your client or patient, even though Kelly practices this
Lovely.
for this
Yeah.
session. So I will be your assistant in this, Sheena, because we are virtual, which works. And I'll leave it to you two.
Thank you both. Thank you for being here. And thanks for organizing this. It's just a great idea. So Kelly, if we want to just kind of turn away from us discussing everything and stuff and just kind of start to turn into your own system, and you may or may not already have something, an issue, an event, a topic, you know, something that you would like to look through glasses at today. And just let me know, like, if your system needs a little bit of breathing, and just take a nice deep breath. And a nice slow, long breath out. And just land a little bit in some centeredness. And just as you turn inside, what's coming up for you today that you'd like to shine or look through some colored glasses at today?
Fear.
Fear? Okay. Is there a specific event? You don't have to talk about what it is, but is there a specific event that creates the fear?
Yes.
Okay. And do you have an image associated with that event?
Yes.
And when you bring up that kind of worst moment of that event, how strong is that fear from a 0 being not at all to 10 being super strong?
An 8.
And do you feel this fear of 8 of fear anywhere in your body?
Feel it like all on my left side, my left chest into my abdomen.
And what do you say to yourself? What does this 8 of fear say? Not the fix it to try and like make it better. But what does that 8 of fear say? Does it have any words?
I'm not safe.
Mm.
I need help.
Okay. And now, Lisa, can you get the red glasses to start with, please? And if there's a window nearby or some kind of like natural light, if you can, just try and look through the red glasses out the window if that's possible. And if there's no window, that's okay too. And what happens to your issue when you look through the red glasses?
It feels more confusing.
More confusing. And
Yeah, more lost.
more lost?
Yeah.
Mm-hmm. And do you like the red?
No.
No. Okay. Let's go to the orange, please. What happens when you bring up your issue?
Feels more easeful. Like I almost don't really care about it.
Mm.
I wouldn't say it feels good or safe. It's just kind of not on my radar,
Mhm, mhm,
almost hard to access.
harder to access. And do you like the orange?
Neutral.
Neutral. Can we go to the yellow, please, Lisa? What happens when you bring up your issue looking through the yellow?
I feel hope.
Mhm,
More safety.
mhm. And do you like the yellow?
Yeah.
Mhm, mhm. Beautiful. You go to the green now, please. What happens when you bring up your issue?
Feels hard to access it. Like my brain's out in la la land.
And do you like the green?
I don't think so.
No.
No.
Mhm. Do we have the blue now, please, Lisa? Thank you. What happens when you bring up your issue with the blue?
I feel calm about the issue.
And do you like the blue?
Yeah.
Do you like it better than the yellow?
Yeah.
Okay. We can go to the indigo, please. Happens when you think of your fear, when you bring up your fear, go to your issue.
I feel safe in these.
Do you like those ones
Mm-hmm.
better than the blue?
I don't know.
Close.
Mm-hmm.
Okay. And go to the violet, please.
Should do some work on these. Ish.
What happens when you bring up your issues through the violet?
Feel clarity.
Hmm. And do you like the violet?
The others feel more comfortable and safe.
Mhm. When you bring up that fear, what number is it at?
Four.
And the body sensations, are they still the same?
I still feel it on my left side.
Mhm.
Maybe not as strong, but
Still feeling sensations on that left side, chest and gut.
mm-hmm.
Can you start with the red again, please, Lisa? As you look through the red, Kelly, what happens when you go to your issue?
Feels like a little discombobulating. To kind of confusing again.
Again, please. What happens when you look through the orange?
the issue goes away and I can't find it.
And do you like the orange?
Not necessarily, no.
Okay. The yellow, please. What happens when you look through the yellow?
A blank.
And then you bring up your issue, the fear.
Hard to access, but it almost feels like complacent, like it's like I've resigned to it.
Mm. And the green, please. What happens when you look through your clean green?
The fear doesn't feel as daunting. It feels manageable.
And do you like the green?
Mm-hmm. Yeah.
Mm-hmm. And the blue, please. What happens with the blue?
Feels like the fear is overcome, like I'm on the other side of it. It doesn't feel as scary.
And do you like the blue?
I like the blue and I like the green more though. Mm-hmm.
Lovely. Indigo, please. What happens when you look through the indigo?
You feel more anxiety coming up.
Mm.
Yeah.
And the violet? happens when you bring up your fear when you look through the pile?
I feel stuck.
And what number is the fear at when you bring up the fear?
With these on?
Yep.
Say a 2 in general right now.
Okay. So can you go back to the green? Those are the ones that you like the best.
Like when I had those on, it feels like if I kept them on, it would elevate.
Mm-hmm. What number are you at with the green on?
Yeah, I don't feel fearful. I feel hopeful with these on. So it's not, I'd say a 0. It's not in existence.
Yeah. Does your system feel like it needs one more lap to kind of get rid of any of that residual anxiety that comes up with some of the colors? Or does it feel settled enough now with the green?
It feels settled.
Okay,
Mm-hmm.
okay. And what about the physical sensations?
Hmm. It's like kind of settled lower in my abdomen, but not bothersome. It's not a swirling anxiety that was before.
Beautiful,
It's like it feels stable.
stable, nice. And what do you say to yourself when you kind of bring up this event?
Get after it head on, like deal with it. Go full force, full speed ahead.
So now we can go to the turquoise. Lisa, please. And then the pink ones, please. What happens with the pink?
It's calm.
Hmm.
Grounded.
And finally, the magenta, please. And these aqua and pink and magenta at the end just kind of install this new positive cognition of getting after it and full speed ahead. And think about that first thought, the event at the very beginning, and go back to that and what happens.
Feel compassion for myself in that situation. And hope.
Is there anything that your system needs after going through all of these glasses? Just check in. You don't even have to think about it. Like, just ask your system, is there anything that I need?
No.
Thank you so much to you and your system for sharing. Really beautiful.
Thank you.
You're welcome.
Thank you.
Leaves us on.
No. No.
Whatever your system wants. And if you'd like to wear one of the glasses that you liked best for 10 minutes or so, you're more than welcome to, but you don't have to.
Okay.
Is there one?
Please.
Neat.
Yeah, that's so nice.
Nice. Yeah. And a lot of people ask, different details about the colored glasses. Like it's different looking through a colored glass than being exposed to a colored glass. So there's some reintegration going on, and it can trigger emotional and physical responses. And a few moments of the right color can really correct like a distorted mind body information. And so it's that equalizing and that rebalancing that happens with looking through the colored glasses. And a lot of them, the specific color, it has a specific wavelength, and it has both a neurological and a psychological effect. And so Dr. Cease and his colleagues did a lot of experimenting as to which colors, which order, and that kind of thing to come up with this specific protocol. So each of the different colors have, they have a different action on the central nervous system, right? There's a wide range of conscious and subconscious reactions regarding colors, and Dietrich Klinghardt wrote quite a few articles and publications about the impact of color. So just wanted to give you that little tidbit on a little bit of background.
Before you ask questions, I just have one based on what you just said that I've been met with. The difference between looking through the colored lenses or just looking at a wall that's painted red or an orange shirt or being in nature and seeing green. What's the difference there?
So there's a different impact on your neurology looking through the glasses, right? And then other colors being shone on your skin, wearing it. They're all different impacts. And I don't know if you noticed it, Kelly, but even with all the different colors, you were having different physical sensations. You would know that because you're quite body aware.
We like catching.
Yeah. And just your facial expressions, your shoulders, different aspects. So your body's giving a huge amount of information, and resonating in that as well.
So Sheena, you were dialed into, the changes in Kelly, and so was I, but how did you feel? Like, did you feel incredibly different with each? Or is it gentle?
I mean, it's quite immediate with putting each one on and then almost internally watching the feedback of my body. Like with the breath, with sensations in my abdomen. Do my thoughts speed up? Do they slow down? Does it throw me into like weird childhood stuff? Does the future seem more easy to manage? Yeah, all of it.
All of it. So, so it's interesting because I'm listening to Kelly speak and my brain obviously works differently. And as an observer or someone who's just assisting, passing smudged or clean glasses, but it's interesting because I listen to Kelly speak and I'm thinking about somebody who might be watching this and say, she's very in tune with herself. I would judge you that way. Like you're very aware, you're able to express. I saw as you very calmly, consciously put each pair on and dialed into yourself. But often we might be working with a child who's not necessarily in tune with themselves that way, or somebody who doesn't do nervous system work on themselves and they might be very stressed. So I'm wondering, I'm asking both of you, since you both practice this and she's teaching it, how that protocol would work on somebody who is not necessarily able to ground, calm, and dial in.
You want to answer first, Kelly, or do you want me to?
From my experience, what I've seen is it's a speedway to cut through that from what I've seen. So somebody who might be so up in their head and they've got the whole talk down and what they need to say to their nervous system and they're very cognitive, it cuts through that straight to what their system needs, in my experience. And so it's like they can't control it, they can't hack it.
Right.
Is what I've experienced. So it's, for me, even more so those people, because in talk therapy or maybe some other modalities that they've done, they might be able to manipulate it in a way that might not serve their system. And on this, they can't.
Right.
Yeah. Or if their system is open for it and ready, it's going to go straight to it.
Which is why anyone who's practiced for a long time, I imagine, Sheena, you've probably seen many of them since you've trained so many in this, but like someone who's talk therapy or psychotherapy or massage, it's like to actually have that experience that you're talking about of cutting through something to get to makes almost any modality more effective. So this would be like an add-on to something else or a standalone treatment, either way, right?
Yeah, it's an amazing tool. Just with your point too, Kelly, I've had clients that are very much in their heads, CEOs, this is the list, blah, 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 very serious. And they'll put a color on and burst into laughter. Like you almost laughed a few times, like it makes you feel like laughing. And this one client I'm thinking of was like,
yeah.
She's like, how can this make me feel like that? Like so blown away. So you're absolutely right when you say it kind of cuts through all of that. The other really neat thing is you'll notice, what I've noticed is that with many people, their system of protection will start to come up with different colors. And your system did that a little bit too, but just because we were doing just colored glasses, I just stuck with exactly the colored glasses. But a lot of our system too, when something kind of negative starts to come up, our system really has the option, like the will to kind of stop it. But you'll notice that even when it was a slightly negative feeling that you had coming up. You held space for it, and so did I. I didn't just say, okay, next one then, because sometimes you got to connect with that, stir it up a little bit, like not to overwhelm and be too much, but just to stir it up a little bit so then it can move.
Yeah.
So
And you use your own way of guiding as well. Like you were patient with yourself,
Right.
and you were patient with Kelly, which is it was so beautiful to watch. But I imagine that, I've practiced where it's like, oh, I'm like, meaning somebody has the glasses on for 3 seconds and they're like, no. And that's okay too. There's no science or exact process for this, right?
Right. Watching what the system does naturally.
and sometimes if it's like a no, it's like, if something's coming up, welcoming it.
Hmm.
Because it's welcoming. Like your system has such innate wisdom. We're really, really programmed to avoid discomfort.
Mhm.
Sometimes if you have a little bit of discomfort, it's actually going to be so much better for your system because your system can handle discomfort. We're incredibly resilient. It's restoring that resilience. And so depending on it, really holding space for that. And the other thing I'm going to say is the loop. So it's red, orange, yellow, green, blue, indigo, violet. The loops are totally different because one loop, you really liked one color and didn't like another color. The next loop, so talk a little bit about like how different the same color can be on a different loop.
Yeah.
Like, did you notice that there was?
Yeah. I mean, that second go around felt like the first time. It didn't, I think maybe a couple of the colors I had maybe similar experiences, but I'm not quite sure if that's true or not.
I found it interesting that you verbalized it differently, even though from where I sat, I was like, oh, this isn't her favorite, but you expressed it so differently, like in words, in
Yeah.
language. And that's such a amazing takeaway too.
Yeah. Yeah.
And sometimes it can have a positive impact, but you actually don't like the glasses. Sometimes it can have a negative impact, but you actually really like them because there's a component in your unconscious that knows that you need it almost. You know what I mean? Like this is me, like
work through it, and then some of them it's gone. I can't even find it, and that was frustrating to me. Even though it felt good, I don't feel fear right now. Like no, I have a goal of working through it.
see, and interesting
that
too,
aside
right?
too was interesting.
Exactly. And then those parts kind of come in and say, oh, we need to do it like this. And you're like, and just
Yeah.
having them sit next to you and just the wisdom of your system knows exactly what you want to do.
It's a beautiful way to look at it. And practically now, for somebody watching who's like, wow, is that what your typical session looks like? Is there a typical session? Do you ever do 1 round of classes? Do you ever do 3 rounds or 5 rounds of classes?
Really great question. It's similar to what I do. I, in this situation, would have done a little bit of IFS in the situation, which was really interesting for me because I'm not constrained to just one modality because I incorporate all of my modalities, but I'm just trying to keep it to the colored classes. It's very common to just have one loop and it just goes from 8 down to 0. It's very common to have 2 loops and 3 loops. Just because if you notice, I asked her wisdom of her system if she wanted 1 more loop. And the only reason why I asked that is there was a little bit of not even resistance, but a little bit of not even uncertainty, but you noticed that to me, it felt like there was just a little bit more that needed to.
It wasn't clear that it was 1, so you might as well do a second kind of thing.
Well, it was 0, like it was clear, but there was just a couple of little parts along the way, which could have been totally resolved. And that's why I asked, because I don't know, but she knows.
Right.
So I was thinking, there's a couple of little things that maybe we should just make sure to check in with. So that's what I do. Like your system knows exactly what to do, not so much me.
Right. And what about you when you're practicing? How many loops are you finding, like your answer to that question?
I would say a majority of them, it's one loop. With a significant decrease to where you're at a 0 or a 1. And then when I ask them, is there anything else that they need, or I've asked, would you like to go through another round? Does that sound like something that your system needs right now? And I've had a couple people say yes.
Right,
And again, it's like a whole different experience. Or something was brought up during the first round that maybe traced back to the originating event where the emotion, the fear came from, or whatever it was they were working through. And then they want to look at that.
so,
Yeah.
so that's so interesting, and, Sheena, you brought up IFS, and you have a different, like, we all have different toolboxes that we bring, and so that's the other thing that I personally love from a, like, business standpoint, from a practical standpoint, from a functional standpoint, is not I have to give this up and I'm going to
Right.
learn how to practice this, or I'm going to give my therapist up because I have glasses, but it's to bring this in, to introduce this into your life, because it is, I would use the word magical, but not like magical as in too good to be true, like magical as in
Effective.
effective
Mhm.
and beautiful and powerful. And so I'm so grateful that we have this. I think it's around 45 minutes with our conversation. And, obviously the experience is very different with a third person, me
Mhm.
sitting beside you, passing you glasses, Sheena in Zoom, and you still had like
Right. A
like
profound effect.
a profound
Yeah.
effect.
I think one thing that's so interesting for me too, in some of these modalities that we're exploring, colored glasses therapy, auricular chromotherapy, is my system and my experience is very science-based and Western medicine based. And so have historically been opposed to things that are outside of those realms. And so coming at this with a bit of resistance, and then having the experience of it not only being so powerful for me, but then offering this to my patients and clients and seeing that effect, and the testimonials that we're seeing from that, it's a great eye opener.
Yeah.
Yeah.
And
Yeah.
that's the whole purpose between
Yeah.
the three of us coming, and it's for anyone listening, Kelly is incredible as a guide. Seriously, as in somebody who creates space for others to be themselves. Sheena, you have that in as a teacher, as a guide, as a healer, however it is. I'm just want as many people to take the course or to experience this,
Yeah,
not
this is
because
important.
I have no gain beyond feeling so grateful that I know you and get to experience this and get to know this and get to pass it on. And so for anyone listening, Kelly practices, Sheena teaches this. Reach out to me, reach out to any of us to ask any questions about anything. And I love the idea of looking through glasses. I love the rose-colored glasses, that the joke that comes along with it, and now that it's actually a real thing that can help, I think it's beautiful. So thank you.
I love that it's the Rose Lab as well, so it really fits in.
Exactly.
Right.
It's a good name,
Yeah.
a good course, good people, good name, good outcome, and beautiful.
Yeah.
Thank
Thank you,
you.
Sheena.
Thank you,
Lisa.
Sheena. Yeah.